Okay, so let's talk about something that can be pretty unsettling. Experiencing unexpected pain, some light bleeding. It's totally normal to feel worried. So today, we're going to break down what that left side pelvic pain with a bit of spotting might actually mean. We're just going to walk through the possibilities so you can get a better handle on what could be happening inside your body. So you're feeling that little ache on your left side, and you've noticed some light spotting or what some people call bloody threads. The first question that pops into your head is probably, okay, should I be worried? And you know what? That's a completely fair question. Our goal here isn't to give you a diagnosis, but to replace that worry with some solid understanding. We're just going to go through the potential causes one step at a time. Let's dive in. All right, to make sense of everything, here's our game plan. First, we're going to get really clear on what the symptoms actually are. Then we'll explore 3 of the most common reasons this might be happening: hormonal stuff, things related to pregnancy, and infections. And then we'll get to the most important part. What are your next steps? How do you actually get a diagnosis and start feeling better? Okay, first things first. Let's get really precise about these symptoms, because understanding what's happening is the very first step to figuring out why it's happening.
So when we talk about light bloody threads, what does that even mean? It's really just spotting. It's that small amount of blood you might see when you're not on your period. And you might notice the color can change. Sometimes it's light red, which is newer blood, or it could be a darker brown. That just means the blood has been around a little longer. Both are super common.
And what about the pain? Well, typically it's described as a kind of persistent ache, down in the lower left side of your abdomen. And it's not at all unusual for that feeling to kind of wrap around or radiate into your lower back. Recognizing that specific sensation is a really key piece of the puzzle. All right, let's dig into our first and, honestly, one of the most common reasons for these symptoms. A lot of the time, the answer lies with our body's own powerful chemical messengers, our hormones. So just think of your hormones as the conductors of an orchestra, the orchestra being your menstrual cycle. They're in charge of building up that uterine lining every single month. But if that delicate balance of hormones gets even a little bit off, the whole system can get slightly out of tune. So how does that hormonal imbalance turn into what you're actually feeling? It's pretty much a chain reaction. That irregular balance can cause little bits of the uterine lining to break down when they're not supposed to. And that is what leads to the light, unexpected bleeding and that cramping or pain that comes with it.
Now, we're going to move on to another really big possibility, and it's one that needs some careful attention. Let's talk about causes that are related to pregnancy.
This is probably the big question on your mind, right? If you're experiencing this, you're probably wondering, could I be pregnant? And the short answer is yes. These symptoms absolutely can be an early sign of pregnancy. But, and this is a big but, it is so important to understand the different ways that can happen because they are not all the same. Okay, this slide right here is incredibly important because it shows 2 very, very different situations. On one hand, you have something called implantation bleeding. This is totally normal. It's just some light spotting that can happen when a fertilized egg snuggles into the uterine wall. But on the other hand, you have an ectopic pregnancy. This is where the egg implants somewhere it shouldn't, like the fallopian tube. And just look at the difference in urgency. One is normal, the other is a true medical emergency. I really want to emphasize this point. If that pain on your left side suddenly changes from a dull ache to something sharp or severe, that is a major warning sign. That is not something you wait and see on. It requires immediate medical help to prevent some very serious complications. Okay, so moving on from hormones and pregnancy, let's look at a third common possibility, and that's infections, where the real troublemaker is inflammation. So how does an infection lead to these specific symptoms? Well, an infection, whether it's bacterial or viral, can cause inflammation in your reproductive tract. This makes all the tissues in there swollen and super sensitive, which means they can bleed really easily. And if that infection settles in one spot, say your left ovary or fallopian tube, that's exactly why you'd feel that specific one-sided pain. You might even notice other things, like pain when you pee, which is another big clue.
So we've covered the potential what and why. Now for the most empowering part of all this, what you can actually do about it. Let's talk about the path to getting some answers and ultimately feeling better.
The absolute first step is to shift your mindset from worrying to understanding. And the only real way to know what's going on for sure is to team up with a medical professional. Seriously, think of your doctor as your guide on this journey to getting a clear diagnosis and, honestly, just getting some peace of mind.
So, what does that journey actually look like? It's usually a pretty straightforward process. It'll start with a visit to a specialist, like a gynecologist. From there, they'll likely suggest an ultrasound scan to get a good look at what's going on inside. They might also want to do some blood tests to check on your hormone levels or to confirm a pregnancy.
And all of this leads to the end goal, a treatment plan that's made just for you, based on what's actually causing the issue. If it's a hormonal imbalance, it might be medication to get your cycle back on track. If it's an infection, it'll probably be antibiotics. And if it's anything related to pregnancy, the plan will involve either very close monitoring or some kind of medical intervention. The most important thing to see here is that for every cause, there is a solution.
And beyond any medical treatments, it's always worth remembering that your day-to-day habits can play a really important supporting role, especially when we're talking about hormonal balance and just your overall reproductive health.
Now, this stuff isn't meant to replace a doctor's advice, of course, but it can definitely complement it. We're talking about simple things like maintaining a healthy weight, getting some regular, moderate exercise, and finding healthy ways to manage your stress. All these things are proven to have a really positive effect on your hormonal health. Look, if there is just one single thing that you take away from all this, please let it be this. These symptoms have a whole range of possible causes, from something really simple to something more serious. Trying to figure it out on your own through the internet, it's not just hard, it can actually be risky. The only person who can truly connect the dots and get you the right treatment is a qualified doctor. So we'll end with this thought. Your health is your #1 priority. It's your most valuable asset, and you absolutely deserve to have clarity and peace of mind. Making that appointment isn't just about dealing with a symptom, it's about putting your own well-being first. So really, why wait to get the answers you need?